Hey everyone, I hope you're all having a great Friday. It doesn't look like I've got anybody coming in today, so I'm just going to do a quick video on the muscular system. Yesterday, we talked a little bit about muscles of the head and neck, so I'm going to continue that today. So let me share my screen. So as we're studying the muscular system, we're really focusing on skeletal muscles. And skeletal muscles are attached to bones. Skeletal muscles create movement by pulling on the bones to which they're attached. And skeletal muscle is not attached directly to bone, but it's attached to the periosteum, or the outer layer of bone, by dense cords of connective tissue called tendons. Skeletal muscles are voluntary, meaning that they can be contracted or relaxed under conscious control. Skeletal muscles can be thought of as having three main parts: the origin, the insertion, and the belly of the muscle. The origin of a muscle is normally the proximal end, meaning towards the point of attachment. And the origin is generally attached to the fixed or the stationary bone, the bone that does not move. The insertion is at the distal end of the muscle, and it's attached to the movable bone. And the belly of the muscle is the main fleshy portion of the muscle, also known as the body of the muscle. So there's different forms of muscle contraction. In the lecture, we talked about tonic contraction, and there's several other different types of muscular contractions. Twitch contractions are rapid, jerky contractions in response to a stimulus. Tetanic contractions are sustained contractions, and these are associated with cramps and convulsions. When we talk about microbiology, we talk about the microbe Clostridium tetani, which causes the disease tetanus or lockjaw. And it's where the muscles that start in the jaw, they have uncontrollable contractions, and it eventually leads to contraction of the respiratory system and death. So you can associate tetanic contractions with tetanus, but it's also for less serious things like cramps and convulsions. There is isotonic contractions, and this is what we normally think of when muscles undergo their normal movement. There's a constant equal contraction involved. When an isotonic contraction occurs, the muscle shortens and pulls on another body part, like a bone, to create movement. Isometric contractions involve a constant tension put upon a muscle, but little to no movement will occur. So tension increases within the muscle. The muscle does not shorten and result in movement of a body part. And this can be demonstrated by pressing your palm down on the desktop if you're sitting, where you're compressing that muscle, but you're not producing a movement. You can also think of this like with yoga, where you're holding a pose for some time, or leaning against the wall, where you're compressing, contracting that muscle, but you're not producing a movement. So that's isometric contractions. So like we've talked about before, muscles, skeletal muscles are named for a variety of different reasons: their shape and location, divisions and attachments, the direction of their fibers, whether these muscles are located superficially or deep, or just the size of the muscle. So skeletal muscles named by shape, these are just a few examples. The deltoid, Muscle is named from the Greek origin delta, meaning a triangle, and the suffix oid, meaning resembling. So the deltoid is a triangular muscle of the shoulder, and it has to do with lifting the arm to the side. The latissimus dorsi is a large flat muscle on the back responsible for extension, adduction, flexion, and rotation of the shoulder joint. The teres major is named because it's rounded and it's positioned above the latissimus dorsi muscle and assists in extension and rotation of the humerus bone. The trapezius is a large back muscle that resembles a trapezoid in shape. The serratus muscle is a fan-shaped muscle that originates on the superolateral surfaces of the first 8 ribs. It's sawtooth shaped. That's where it gets its name. You can think of like a serrated knife, and it has that shape. And the rhomboids are a large group of muscles in the upper back responsible for forming the shoulder girdle. And it holds the shoulder blade and the shoulder stable. Muscles named by location, a few examples, you can think of the epicranius, which means around the cranium, or the tibialis anterior, so anterior meaning towards the front, so it's in front of the tibia. Muscles named by location, if you see dorsi, it means towards the back, typically like latissimus dorsi, so a very large wide muscle of the back. If you see abdominis, it's referring to the abdominal region. You see femoris, it's in the femoral region. So we're just playing word association. Muscles named by the direction of fibers. This is described in reference to the midline of the body. The rectus abdominis is straight down the abdomen. The rectus femoris would be straight down the femur. And the oblique muscles of the abdomen run at angles toward the midline, so they get the name oblique. Skeletal muscles named by size. We have maximus, which means largest. So you can think gluteus maximus, which is the main extensor muscle of the hip. It's the largest and heaviest muscle in the body. Minimus means smallest. So gluteus minimus would be the smallest muscle of the gluteal region. Vastus means huge. So the vastus lateralis is the largest of the quadriceps. Longus would mean longest, like the adductor longus, which is a hip abductor muscle located in the inner thigh. Brevis means short. You can think like brevity means short. So the flexor digiti minimi brevi. So flexor meaning flexion, digiti meaning fingers, minimi meaning small or short, and brevi. So it flexes the little finger at the metacarpophalangeal joint. Major means large, like the pectoralis major, which is a large muscle of the chest. Minor means small, so the pectoralis minor would be the small muscle of the chest. And then we have muscles named based on the number of divisions that make up the muscle. So biceps literally means 2 heads. So bi meaning 2, ceps referring to cephalic, meaning the head. So the biceps muscle has 2 heads, a short head and a long head, and it's distinguished by their origin. So the short head goes to the coracoid process and the long would go to the supraglenoid process. Triceps means there's 3 divisions. So it has a medial, lateral, and a long head. And each of these 3 heads originate in a different location, but they all come together at their distal end, meaning away from the point of attachment. And the quadriceps, you can see there's 4 different colors here. So there's 4 parts. quad meaning four, the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. All four of the quad muscles come together just above the patella. Then we have muscles named based on their attachment. So we go back to the anterior cervical triangle, which is so integral to us as embalmers, and think about the sternocleidomastoid muscle, or the SCM muscle, which attaches at the origin of the sternum and the clavicle, and it inserts at the mastoid process of the temporal bone. So it's articulating with the sternum, the clavicle, and the mastoid process. So that's where it gets its name from. We have muscles named based on their actions. So we go back to muscular actions, and we talked about this with joints and muscles. Abduction means away from the median plane, and that would be an abductor. Adduction is towards the median plane, so it's an adductor. Flexion would be the act of bending. These are flexors. Extensors do the action of straightening. Pronation are pronators, so it's like turning the hand palm with the arm palm down, and supinators would be palm up. If you see levator, it means it's going to lift something or raise. And depressors do the act of depression or lowering. So those are easy to distinguish if you know what those actions mean. We also have rotation, which is movement around an axis. Circumduction, which is turning or swinging a body part in a circular motion, like you're playing airplanes, maybe. Constriction would be the squeezing closed of a body orifice. Dilation is widening or opening of an orifice. And these usually refer to rings of muscles known as sphincters. Protraction is a forward movement of a body part. Retraction is a backward movement of a body part. Sorry, my cat's got into some plastic or something, if you hear that. Eversion and inversion, so turning the sole of the foot outward and inward, respectively. So yesterday we talked a little about muscles of facial expression. So this is just a few of those. The zygomaticus major is the smiling muscle or the laughing muscle. The orbicularis oris is puckering of the lips. So remember that oris is referring to the oral region or the mouth. The buccinator puffs the cheeks out. The frontalis will raise the eyebrows. The risorius is the false smile muscle. The platysma pulls the lower lip down and back as if in horror. We have muscles of mastication, which is chewing, right? And next week, we're going to talk about the digestive system. So we'll talk about these. The temporalis, the masseter, the internal pterygoid, and the external pterygoid. And that's just in reference to the region that they're in. This is the start of the video that we did yesterday, where I started at the top of the head. Let's talk a little about the anterior cervical triangle before we move on. So this is one of our major areas for embalming. This is what we use to locate the common carotid artery and the internal jugular vein, the boundaries of this triangle. So if I were to take a marker, I'm not going to do this, but we're going to take a marker and draw a triangle to locate those structures. The medial boundary of that triangle would be the midline of the neck. The superior boundary of the triangle would be the inferior border of the mandible, and the lateral border of that triangle would be the SCM or the sternocleidomastoid muscle. So that will form a triangle on the anterior or front part of the neck. That's part of our topographical anatomy. As embalmers, it's very integral to know. So I'm going to skip over skeletal muscles of the head and neck. So we've already done that. And go to skeletal muscles of the trunk of the body or the torso. So the first is the trapezius. It's going to elevate the clavicle, adduct the scapula, rotate the scapula superiorly, elevate or depress the scapula, and it will extend the head. So that is a back muscle that's in that trapezoid shape. You only see half of it here. The latissimus dorsi. So latissimus meaning wide, dorsi meaning back, is a back muscle that extends, adducts, and rotates the arm medially. It will draw the arm inferiorly and posteriorly. So you can kind of feel it when you move your arm. And then the erector spinae is involved with movement of the vertebral column. It keeps the spine in an erect position. So that was dorsal, the back muscles. Now we have the chest muscles. The pectoralis major will flex, adduct, and rotate the arm medially. It's a large muscle of the chest. And then we have our external and internal intercostals. So costal referring to ribs. These will elevate the ribs during inhalation and then draw them back together during exhalation. So when you breathe, your chest expands and then goes back to its resting position. These muscles allow that movement. So let's move to the abdomen. The anterolateral muscles. So antero referring to towards the front, lateral meaning towards the side. We have our external obliques, which will contract and compress the abdomen. Contraction of one side bends the vertebral column laterally, and it internally rotates the vertebral column. Our internal obliques will also compress the abdomen. When you contract one side, it bends the vertebral column to the side and laterally rotates that vertebral column. Both of these are named for referencing oblique, meaning they're going to run at angles to the midline of the body. And then we have the transverse abdominis, which will compress the abdomen. Doesn't look like I have a picture of that one, so let's look it up. So the transverse abdominis muscle. So it's the deepest of all those abdominal muscles and goes from side to side, so transverse. So those were anterolateral to the side abdominal muscles. Now let's talk about anteromedial muscles, which are medial towards the midline. We have the rectus abdominis, which will flex the vertebral column, compress the abdomen to aid in defecation, urination, forced expiration, and childbirth. Then we have the posterior muscles, which are the iliopsoas, and the diaphragm or the phrenic muscle, which is a parachute-shaped muscle that forms the floor of the thoracic cavity. It's going to separate the thoracic cavity from the abdominopelvic cavity. So this is a MATS question that you'll see when you're doing your testing for funeral service for prep for the national board. It'll say, it's basically asking what area, which of these muscles is in the abdominal area, or all of these muscles are upper extremity muscles except for this. So the psoas major will run from the lumbar vertebrae down the femur, and this will move the femur, and it acts as an anatomical guide for locating the external iliac artery and vein. It's also a posterior muscle. So just wanted to highlight that one again. So let's talk about skeletal muscles of the upper extremity. And you'll notice I'm not doing every muscle of the body because there's over 600. So we're just doing the ones specific to our curriculum as funeral service science students. So in the upper extremity, we have the deltoid, which is the triangle shaped muscle. It abducts, flexes, extends, and rotates the arm. The teres major will extend the arm. And within the arm, we also have the biceps brachii, triceps brachii, coracobrachialis, referring to its location near the coracoid process, and the brachialis. So anytime you see brachii or brachial, it's referring to the arm region. So don't be fooled. Some students will see biceps and immediately think, okay, that's my biceps. That's an arm muscle, right? That's not true because you also have a biceps femoris in your leg that's in the femoral region. So always look at the entire phrase when you're trying to break down these words for what location they're at. So biceps brachii, triceps brachii, and the brachial region. All of these function in movement of the arm. Anterior muscles of the forearm will include the flexor carpi radialis. So let's break that word down. Flexor means flexus, carpi referring to the wrist, and radialis referring to the location of that muscle near the radius. So flexor carpi radialis will flex and abduct the wrist. Flexor carpi ulnaris will flex and abduct the wrist, and ulnaris is referring to that location. And then we have flexor digitorum superficialis. So flexor is a muscle that's going to do the action of flexion. Digitorum referring to the fingers, and superficialis would mean it's superficial. So the flexor digitorum superficialis will flex the middle phalange of each finger. For the posterior muscles of the arm, remember we're always speaking in reference to anatomical position, okay? So for example, the radial side of the arm is going to be lateral and the ulnar side is going to be medial, because I'm always referring to anatomical position. So the posterior muscles of the arm are referring to when you have your arm in anatomical position. And these are towards the back. We have the brachioradialis, which will flex the forearm. And you see that brachio referring to the brachial region. So you know it's a muscle of the upper extremity. Then we have the supinator. So think supine. If a body's in supine position, that means it's face up. It also means palm up. So it will supinate the forearm and the hand. And those are the muscles that you need to know for the upper extremity. Then we have muscles of the lower extremity. We have the gluteal region, which is the gluteus maximus, which will extend and rotate the thigh laterally or to the side. It's a very large muscle. The anterior femoral thigh, so on the front of our thighs, we have the sartorius muscle, which will flex the leg. It flexes the thigh and rotates it laterally. So it's also known as the Taylor's muscle. So this is the muscle that you use when you cross your leg. It's the longest muscle in the body. It's also part of our femoral triangle for embalming. It's one of the borders to look for the femoral artery. Then we have the quadriceps femoris, which is comprised of 4 muscles that will extend the leg and laterally rotate and abduct the thigh. The four different divisions are the rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius. So vastus meaning wide, very large muscle. And this is the sartorius muscle right here. The medial femoral muscles will include the adductor longus, which will adduct and medially rotate and flex the thigh. And it is the medial border of the femoral triangle. So, or the Scarpa's triangle. So referring back to embalming to find that femoral artery, femoral vein. And then we have the adductor magnus. So you'll see both of these have the name adductor in them, and that's referring to the action that that muscle produces. So the adductor magnus will adduct and medially rotate the thigh. The anterior part will flex and the posterior part will extend the thigh. Then we have our hamstrings, which are posterior muscles of the thigh. The biceps femoris, the semitendinosus, and the semimembranosus. All of these are our hamstrings. Then we have anterior muscles of the leg. We're going to move down to the lower or the distal part of the leg, the tibialis anterior. So anterior meaning in front of, tibialis referring to the tibia. And we have the posterior muscles of the leg. We have 3 calf muscles connected to the calcaneal bone of the foot by the Achilles tendon, also known as the calcaneal tendon. And this includes the gastrocnemius. So make sure you don't confuse yourself. Usually if we see gastro, we're like, oh, gastric, towards the stomach. No, this is one of your calf muscles. And then we have the soleus and the plantaris. So these will plantar flex the foot. And those are the muscles that you need to know for this lesson. Feel free to reach out if you have any questions or concerns. And thanks for joining me today. Okay, have a great day.